Hello again, Dr. Mark with True Sport Care. So we just recently showed you posterior hip capsule, so now we're going to show you, we showed you the anterior hip capsule, we're going to show you the posterior hip capsule now. You'll know you need this when you are on your back and you bring your knee all the way to your chest and you feel some kind of a pinching in the front. I don't even want to say pinching because sometimes patients don't identify it as a pinch, they just go, oh, I have a hip flexor thing. If you're bringing an angle, all right, when you're stretching, there's an angle that's getting smaller, there's an angle that's getting larger. If you have sensations on the smaller angle or the angle that's getting smaller, it's usually a pinch. If you have sensations on the angle that's getting larger, it's usually a stretch. Closing angle pain is proceed with caution. Opening angle pain, proceed without any worry whatsoever. Stretching sensation on the opening angle side is legal. So here's how you stretch your posterior capsule of your hip. I'm going to do it on my hip, on my new hip. Literally my hip that has been replaced. So you get into this position much like the other hip capsule stretch, and you want to get most of your weight on top of the knee. After you do that, you want to move your body in an angle, kind of like from your opposite shoulder to the opposite hip, and you want to move in that angle and put most of your weight on that leg. Notice how my opposite hip is also dropping or dipping, and as I move in that direction, you should feel something stretching right about here, and it's not a muscular stretch. It should feel a little bit different than a muscular stretch, but this is your posterior capsule hip stretch. Use this before doing any of your corrective exercises.